Good morning, guys. It's Dr. Denney and Maddie. We're going to be chatting a little bit about some frequently asked questions that you may have related to diagnostic imaging. Specifically here at this practice, x-rays/radiographs or abdominal or cardiac ultrasound.
Dr. Denney, will my dog need a lab test prior to any diagnostic imaging?
So it really depends on the situation. In most cases, when we're doing diagnostic imaging, I would actually say that most of the time we have our blood work back before our diagnostic imaging, and that's what's telling me, hey, we really need to look into something. Like if your dog has elevated liver values, we're going to be wanting to look and do an ultrasound and go look at the liver and say, hey, what's going on here? So I would say we usually have labs done before diagnostic imaging in most cases, because we do a lot of preventative medicine here and annual blood work. So we catch a lot of problems before they become symptomatic. So we catch things very early at this practice. The other thing that I would state is kind of a caveat to that statement is if we have a patient that comes in that's just sick, and if we come in, we're vomiting, we're diarrhea, or we can't keep anything down, or we straight just don't want to eat, or we just don't feel well. In that instance, we might have diagnostic imaging going at the same time that our blood work is going. So as we get our test results, we get a better clinical picture of what's going on, because that's why we're doing these tests. Dogs and cats coming in for vomiting or diarrhea, the list of possibilities is pages. Because if you think about it, every abdominal organ that could be having problems can cause these symptoms. So we have to very quickly narrow the field down so we can do a targeted treatment plan to figure out, like, okay, hey, how can we address this? Is it the liver that's having problems? Well, then we're going to do liver medication, possible hospitalization. I mean, there's a lot that goes into it. But these diagnostics are there to help us narrow the field. Because if I'm looking at a dog that comes in for vomiting and diarrhea, and I don't have any imaging or lab work, I have to just treat symptomatically. And that's not always the best, because what if the liver is failing and we're just addressing tummy upset and we don't address the liver disease? Or what if a dog comes in, like an older patient that's vomiting and doesn't feel well, and the owner maybe doesn't want to, or maybe can't afford diagnostic imaging, and we treat symptomatically. And what if that patient has a big honking tumor or cancer in its abdomen? We would have made a completely different decision on kind of what to do and what steps to move forward if we had had that imaging. So that's really, really important. So I would say that it really depends on the situation. In most cases at this practice, because we do so much preventative medicine, we're probably going to have our lab work done before diagnostic imaging.
What can I expect from a dog diagnostic imaging session?
So it's going to be dependent on what we're doing, okay? And the dogs, how they feel. Like, are they stressed that day? Are they in pain? Or are they super chill and relaxed and kind of like a golden retriever, going to let you do whatever you need to do? So most sessions is going to be done without sedation or anesthesia. Most of our patients do just fine. We usually have everything done in less than an hour, especially our x-rays. And if we are statting our x-rays out for a radiologist to look at, we have answers back in less than an hour usually. If we're not statting the x-rays, which is when we get them back a lot faster, those are for my more urgent cases, then we usually have results back in a day or two. But the actual procedure itself, I would say that most are done in less than an hour, if not a half an hour. So it's very quick.
How effective is the use of diagnostic imaging?
So I think that it helps us narrow the field down, and it's going to be dependent on what we're looking for, and we have to look at what our physical exam is telling us, what the blood work is telling us, and then what are we seeing on the x-ray or the ultrasound. So if the dog has eaten a toy, and we take an x-ray and there's the toy, then look what it told us. Oh, Fluffy made a bad life decision and ate something, and now that something's stuck, and look, we can see it right there. So like there are instances like that, or hey, my dog or cat is urinating blood, and when we got our urine sample, I was worried that I, as a veterinarian, was seeing stones in the bladder, because that can cause bloody urine. And we take an x-ray and oh my gosh, look at all the stones in the bladder. So like there are things like this that like you take your x-ray and you're like, oh my gosh, there's our answer. Also in some of our more sad cases, if an older large breed dog comes in limping, and maybe it's just arthritis, but maybe it's not, we have to look for bone cancer, and x-rays are very sensitive for that, for bone cancer. It's very diagnostic, especially if it's farther along in the course of disease, and if I don't catch it, then the radiologist will. But these are definitive answers. And the same goes with ultrasound. If the pancreas, if your dog or cat is coming in for vomiting and abdominal pain and lethargy and hiding, etc., and not wanting to eat, we do an ultrasound. If the pancreas is mad, you're going to see it. A quiet pancreas, like a pancreas that's normal, you're not usually going to see on an ultrasound. You can if you're looking hard enough, but when we're doing our scans, I'm looking for major changes. But when the pancreas is pissed, we see it, like it's there. When the liver is upset, we can see it. If there's a tumor in the spleen, we see that on ultrasound. So we get very definitive answers. Now, there are some times when we don't. And I think that's probably one of the next questions Maddie's gonna ask me is, well, what happens if we do x-rays and we do ultrasound and labs and we still don't have an answer? And my answer to you is, well, but we kind of do, because we know that we've ruled out A through, G on the list of things. We've ruled out hundreds of different diseases. And in those cases, it sucks. I don't like that. I like to have answers back. I don't like when we've invested a lot of financial commitment into a patient, into a case, and not have definitive answers. But it happens, and it happens in human medicine too. And once we get to that point, we're left with, okay, we've rolled out the most common causes of disease. Now we have to start looking at, okay, what do we know based off of the labs, and try to build a picture and start trying to think outside the box. I think veterinary medicine, it's an art form sometimes, and this is where that art and that instinct comes in. My mother is a veterinarian. I've been in this my whole life, and I like to think that I have her instincts. But you have to be able to sit here and clinically look at what the diagnostics you have done, what is the patient doing, and build a list of things that maybe aren't so common. And then we may have to do additional testing to get there. Or in some cases, if I have exhausted all of my resources in the testing that I can get done here, then we may talk about a referral to internal medicine or surgery, or we might talk about referring up to a big gun. I call myself a baby gun. I'm a very capable baby gun, but when we refer up the ladder to the specialist, then we're bringing in kind of more firepower. And they're going to have the ability, and they're going to have at their disposal more intensive or more sensitive testing that we may be able to get done here. So my answer is always, well, we might not have an answer yet, but we know that it's not this huge list of things because we've ruled them out. So in those cases, I agree, it's really frustrating, but you have to kind of stick with it and be open and honest with your veterinarian. I know with my clients, we have a very open dialogue, and I get real with my clients. If I'm frustrated because we don't have an answer, I'm 100% going to tell my clients, hey, I'm really frustrated because we don't have an answer, and I know we've spent XYZ dollars. I'm with you in this. I am a puzzle solver, a problem solver. I like fixing things, I like answers, and I like things to make sense. And when we get cases that don't do that, we know that we're dealing with a more severe problem or something that we need more sensitive testing to diagnose. And so I don't have a problem calling for an internal medicine consult. I do that all the time if I need to. Or actually referring so they can see that pet in person. So just know that while we may not have all the answers right then and there, that I am I'm persistent, and I'm also in your corner. So we'll work as a team to figure out what's going on with your pet. So I hope this helped answer your questions. I know we got into a little more nitty gritty than we might have needed to. If you do have additional questions, please reach out to the clinic or schedule an appointment. I'm more than happy to sit down and talk you through it. Thanks so much, guys. Have a good day.